Well, Dr. Owais Durrani is an emergency medicine physician. He joins me now from Houston, Texas. Owais, thanks so much for joining us. Look, there is so much we don't know and probably never will know. But as a medical professional, what can you ascertain about Kate's condition, knowing what an insidious disease cancer is?
Absolutely. Cancer is a very scary word, and it's scary to all of us when we hear that. What we know is that she had a surgery and that there was low to no suspicion going into that surgery for cancer. Now, anytime you have surgery and you have a mass or a cyst or any type of object that is removed from, in this case, the abdomen, that is sent to a pathologist. And they look at those slides and those cells and see, are there any abnormal cells that we wouldn't expect? It would appear that in this case, there were abnormal cells that were concerning for cancer, which then led to the decision to undergo chemotherapy. So that's basically what we know without speculating too much.
The princess, as you say, had abdominal surgery back in January. She was in hospital for almost 2 weeks recovering. And as you say, it was a result of that surgery that the cancer was detected. I mean, this is quite common to discover cancer this way.
It is, and there is no good cancer diagnosis, but this would be the ideal way to discover cancer. This is what we call a incidental diagnosis, where you go in to deal with another issue, and then you happen to find cancer. And so that means you find it really, really early, and then that gives you the best shot of making sure that you get the proper treatments to ensure it doesn't spread to other areas and that you prevent future cells from going to other areas. So it's not ideal to have cancer, but if you're going to find it, it's good to find it early.
What cancer could this be, considering the initial surgery was abdominal? I realise we are speculating, but as a professional, the surgery was abdominal, so what cancer could it be?
Yeah, so when we say abdomen, that encompasses a wide area. Basically, when, in layperson terms, everything below the chest. A lot of people will include the pelvic region in that. So I'll just list some organs. Once again, we're not saying that this is the type of cancer she has, but we have kidneys, liver, bowels, our colon, the ovaries, the uterus, the cervix. So all of those organs are in the abdominal area. So once again, we have no idea which one of those organs it is, but it could be any of those. And there's a lot of vital organs in that area.
Yeah, I think that's a really important point to clear up, that it's below the chest. It's not just the stomach area. Thank you for clarifying. Kate, as we know, she's 42 years old. I mean, how common is it for young women in this age group to be diagnosed with cancer?
Yeah, so in general, it's not going to be a common diagnosis, but when you look at this age group, females are going to have a higher rate of cancer compared to their male counterparts. We've also seen this trend over the last couple of years of younger people getting cancer, of getting colorectal cancer, other types of cancer. And to be honest, we don't have an exact answer for why that is. And so as more information comes out, this is just a wake-up call for all of us to keep a magnifying glass on this issue and to make sure that we meet with our primary care physicians, we don't miss any screenings. And if you feel that anything is off, make sure you talk to your doctor about it, because getting it early gives you the best chances of survival and getting back to being a normal human being.
When you hear that someone is undergoing chemotherapy, I mean, you immediately associate nausea and hair loss. What other symptoms are related to chemotherapy and the timeline for this treatment?
Yeah, so in terms of timeline, once again, we don't know exactly what type of cancer it is, so it's really going to depend on the type. On the lower end, it could be 3 months. On average, it's around 6 months, and then some treatments can last up to a year. What chemotherapy does is it targets the fast replicating cells. So those are cancer cells, but as you mentioned, hair cells are fast replicating. The lining of our stomach and gut is really fast replicating, so that's where you get nausea, vomiting. You also get immune compromised, so your blood cells and bloodline cells will decrease. And so that's why you may not see someone who's undergoing chemotherapy out in the public, because you want to keep them away from all types of viruses and bacteria out there. Sometimes you'll also have fatigue and numbness and tingling in your hands and arms, and it really depend on what type of chemotherapy you're going through, and everyone responds differently to the various chemotherapies as well.
Doctor, many of us have loved ones who are fighting this insidious disease. To have someone with such a high profile go public about her cancer diagnosis, I mean, how important is that?
It's very important. It tells us that, no human is immune from cancer. It's a human condition, unfortunately. And the fact that she did go public with it is going to help a lot of people. It's going to help a lot of people who may have non-specific symptoms or who may have questions to talk to their doctors and possibly catch things early. As you mentioned, I imagine it is much harder for her, having to share this with the world. I see cancer patients coming into the ER all the time, and it's a very stressful situation on them, on their family, and they're dealing with it in a private manner. And so I think we also have to respect her privacy because she's having to share it with the world, but that's also helping a lot of people as well.
Yeah, absolutely. She was very brave in going public. Dr. Owais Durrani, we really appreciate you taking the time to talk to us. Thank you so much.
Thanks for having me.